What you see here at the start is the result of my MRI, the report. You can have a look at it. I'm happy for the things that it doesn't show, which is like any ligament injury around the knee, so that's intact. Also shows that my meniscus is mostly intact, other than like long-term wear and tear, flattening in a certain section of it. But it also shows, the wear and tear on my knee over years or decades, I should say, of lifting, squatting, etc. With cartilage being the main thing that's been affected in my knee. But overall, it's, not that bad. How I got about this injury, I know now in retrospect what probably happened, and that was like something that happened a few days preceding it, where I was just walking around the house barefoot, going about my business, and I felt like I twisted my left knee, and it hurt a lot, like it was really hurting. And I just shook it out, like you do. You don't expect to get seriously injured or do some major damage just by walking around. And it went away mostly, but I still felt like there was like just a twinge of pain. I'm thinking, I don't know what that was, like, how I pulled it or what I must have done. But I did do something, and if I knew what I did, or to the extent that I did it, I probably wouldn't have squatted at all, or, eased back, or taken 2 weeks off squatting or whatnot. But I didn't know that that's the type of injury I had then. And then when I went to, 2-3 days later, do the squat routine as per my program, that's what was kind of like the straw that broke the camel's back. And the fact that I didn't just do 3 sets of 5, I did 5 by 5, working sets. And that was just a bridge too far for it. And something gave, bone basically rubbed against bone, impacted bone, that caused swelling, inflammation, and neural inhibition around the joint area. That's why I couldn't walk, and that's why the pain and all the rest of the things happened. But it also explains why a lot of that subsided after 5 or so days, and I haven't had any pain or anything, discomfort, for quite a while now, since the incident, I'll call it. So I've been walking around normal, which I'm thankful for. But I do find that I'm guarding that knee and that leg more, like how I walk or when I get up in the morning or after lying down. And also I feel like it gets tired quicker as well, that leg. And also I've had more pain in the right side of me, and my right leg and right knee, and that's because that's been taking on kind of a disproportionate amount of the work. And everything you see in this video is just like kind of the rehab type of stuff I'm doing with the leg presses you saw before, and with this exercise, which helps build the stabilizing muscles around the knee, engages them. It's a very simple exercise, but extremely effective. Just for symmetry, I do both legs, but this is my left one and the left knee that's affected. This doesn't cause me any pain. It just works all the muscles around the knee, making sure they're engaged. Because what I've learned is all these muscles around your joints, they protect the joint. They do a lot of the heavy lifting. If they get fatigued, that's when, they're not protecting the joint enough, and that's when you can actually have an acute injury. So keep that in mind when you're doing like a lot of reps and sets, that it might be beneficial to cut back on those. And that'll be something that I'll be looking into when I do get back into, proper squatting in a couple of weeks. I don't know how many weeks, but I need to probably give at least 4 to 6 weeks for full sort of recovery. and then slowly work my way back into similar weights that I was doing. But yeah, it won't be 5x5, I can tell you that. It'll be probably more 3x5 or something like that, something that's not overly fatiguing. Because if I would have stopped, like one set earlier, this wouldn't have occurred, you know? I mean, I wasn't to know, but you live and you learn. Also, what you see here with these glute breach type things I'm doing, hip thrusting machine. This is also to engage my glutes, because I don't think I engage them enough in any movement I do, be it deadlifts, squats, etc. And they mean a world of difference to protect your back and just make sure everything's dialed in. So I'm going to do a lot of these sort of exercises as well, and obviously work on my upper body and other things as well. So yep, it's going to take time, but yeah, I don't want anyone who gets injured to lose heart. Just be conservative, you know, get the right scans if you can, speak to your doctor, and then just formulate a sort of a plan. But one thing I believe in is active recovery. I don't believe in lying around and waiting things to get better on their own, because mostly they won't. You need blood flow, you need to move, and it's just better for your mental health if you do so. Anyway, that's it for this video.